What are the most deadliest diseases and what is it like to die from them? This week we're going to be covering metastatic colon cancer. Colon cancer is the second leading cause of death in men and women in the US. So let's talk about it. Colon cancer usually metastasizes to the liver, which just means it starts on the colon and then moves to the liver. However, it can also move to other parts of the body like the lungs, the brain, or the peritoneum, which is the membrane lining of your abdominal area. So keep in mind, when I see people on hospice, this is the end of their journey. So what has happened prior, it could have been months, it could be years, it depends on when you find the cancer, where it has moved to, what stage it's in when you first find it. Many people with colon cancer have reoccurrences. They usually have surgery, chemo, radiation, all of this before they see me on hospice. Colon cancer survival is dependent on when it's found. So a lot of times people are coming onto hospice because they found their colon cancer too late. It has metastasized, moved to other parts of their body, sometimes multiple organs. When multiple organs are involved, it can be more deadly. So get your colonoscopies, because 1 in around 20-ish, whether you're a man or a woman, will be diagnosed with colon cancer. And the earlier it's found, the better success rate you have for survival. So the main symptoms I see when someone with metastatic colon cancer comes onto hospice are jaundice, ascites, pain, and shortness of breath. So why do those things happen and how do we manage them? The jaundice and ascites happen because the liver is usually involved, meaning the cancer has moved to the liver. Once it moves to the liver, you start getting liver end-of-life symptoms, which are jaundice and ascites. Jaundice is pretty manageable. You don't really feel anything with it, but you just look a little yellow and like the whites of your eyes are yellow. Now the ascites can cause pain and shortness of breath. So what is it? I've talked about it before, but it's basically a large fluid buildup in your abdomen. And the way we want to manage that is usually, if we can, is to drain it. So a lot of times people will come onto hospice with drains placed in their abdomen so we can drain that fluid at home. That's going to help with pain, and that's going to help with shortness of breath. So how do we manage pain? We manage pain just like any other disease, depending on the severity and what's helpful to you, but we're very good at managing pain on hospice. And the last thing I see with metastatic colon cancer, sometimes dependent on what's going on with the person, is severe nausea and vomiting. Now, I truly don't see this all the time, but if there are tumors involved in the cancer or something going on with the small or large intestine or the colon, if they have a small bowel obstruction, something like that, that can cause severe nausea and vomiting. Usually the person is not well enough to have surgery because of the small bowel obstruction. So sometimes as a last resort, we'll place an NG tube, which is a tube that can go down the nose into your stomach. It's placed onto suction, and when it's on suction, it helps relieve that feeling of nausea and vomiting. There's also tons of medications we can give to help with that symptom. So there's always something we can do to help. So here are some early signs of colon cancer that you can look out for. 1, and this goes for almost all cancers, unexplained weight loss. If you suddenly start losing weight for no reason, always go to your doctor. 2, check out your stools. If your stools are changing consistency or color, please get yourself checked out and go see a doctor. Those are the 2 main things I always see. Jaundice, again, if you start seeing your skin turn yellow or the sclera of your eyes turn yellow, always go see a doctor. These things can be very generalized and maybe it's nothing, but you always want to be an advocate for yourself. So always go get things checked out if anything changes in your health. Like I always say, knowing about the end of life can help you live better and die better. Let me know what disease you want me to do next. Love you guys.